everybody, and welcome back to another Saints podcast. Of course, informational podcast, so you know what's going on here on the campus of Seward County Community College. And we're having a lot of fun bringing these to you, and everybody anticipates the Allied Health podcast, I think. So one of the great things I have, amazing department here today, and say hello to Respiratory Therapy. Hey, good morning, ladies.
Good morning.
Good morning. All right. So if you guys could just kind of introduce yourselves, your titles, kind of what you do here at Seward County Community College.
I can go first. I'm the program director for the Respiratory Therapy program here at Seward County Community College.
Hi, my name is Arlette Austin, and I am the director of clinical education for the Respiratory Therapy program here at Seward County Community College.
Excellent. Respiratory therapy, you guys have no doubt been extremely busy over this last year.
Definitely, you are correct.
So how long have you both been here at Seward County?
This is actually my third year teaching, or third academic school year.
And I am on my fifth academic school year here with Seward County.
Yeah, and it seems like 5 years ago we just had a bunch of us start all about the same time, I think. So, so you guys are respiratory therapy. So what can you tell me about your program?
I'll start us off. So we are a 2-year program, and once you finish your degree with us, you'll have an Associate of Applied Science in Respiratory Therapy. And what that means is you can sit for your national board exams where you can become a certified or registered respiratory therapist. And then once you get those credentials, then you can become licensed to work in any state across the U.S.
And then another component to the program is once we have students in the program, they will complete 750 clinical hours. And we have about 12 clinical sites that we use within the Southwest Kansas and Central Kansas area, so pretty local. And then we also, once we send them to the summer clinical portion of their internship for the program, they will actually be going to Oklahoma City, Wichita, and Lubbock, Texas. Well, they will complete their critical care rotations there, and we can talk a little bit more about that later too. And at that point, then we have a total about 16 clinical sites that we utilize within the program.
Wow, so you guys are just kind of all over the area, making sure people are working in local hospitals anyway.
Yes, it varies from Liberal, it goes up to Wichita, and then back down to Amarillo. And between their academic school year, that's where they're sent to. And then, like I said, in the summer, that's where they go to the further Lubbock, Wichita, and Oklahoma City areas.
Wow, very, very cool. So one thing, kind of before we get into some more of the specifics about, what kind of classes and degrees and courses and things like that, we have, there's always a little bit of confusion about the application process, the admissions process into a lot of our allied health programs. So we have students come in confused and say, well, I applied to Seward County, but, I wasn't sure about the MLT program, or respiratory therapy, you guys specifically. So tell me about your application process.
So you can apply anytime throughout the school year for our program. Some of the other programs, they have a specific window where you can pick up applications and turn them back in. We are a little bit different because we start in January, and most of the other programs start in the fall. So we have what's called a rolling admission. And basically, we'll take applications starting in January all the way up to when we start a new class. We do have kind of a priority deadline for October 1st, so any of the applications we receive before that time will be processed immediately for admission into the program. And then after October 1st, any that we receive up until probably mid-November, then we take those, we process those, and if we have more than 18, that kind of determines more like who gets in and who doesn't get in based on a point criteria system. So everybody's on the point criteria system, but it counts more if you turn it in later as far as like who's admitted and who's not.
Okay, so a little bit more on the point criteria system. Is that kind of similar to some of the other allied health programs, like experience and grades and classes you've taken, that sort of thing?
That is exactly how it is. So I think all of us kind of have that same criteria. If you have hands-on current experience with students, you get more patients is what I did mean. If you have hands-on experience with patients, you get more points. The more prerequisites that you have completed, you get more points. You do have to have a 2.5 GPA, but that's just for the prerequisite courses, not an overall GPA for us. And then we do a phone interview, and that counts towards the points as well.
Very cool. So if anybody has any questions on specifically the respiratory therapy process of how to get in, how to get accepted, get your classes, I would definitely talk to both of you, right?
Yeah,
Yes.
so, I mean, you can always start out with admissions. You can start out with pretty much anybody on campus, and they'll direct you over to the Colvin Family Center for Allied Health. And then our secretary is great about getting you navigated to the program that you're interested in. And you can always stop by. I know as long as the Colvin Family Center for Allied Health building is open, you're welcome to come by, and we'll get you to the right person.
Yeah, for sure. And you have to start with me at least. At least you're going to have to visit me at least once, okay, during this whole process. So very, very cool. So, right, so do we want to talk about like degrees and certifications, or do we want to talk about the courses first? What are we looking at here, ladies?
So the degree is what I said earlier. It's the Associate of Applied Science. And once you get that degree, then that allows you to sit for your national board exam, which allows you to become a credentialed or registered respiratory therapist. And then once you get those credentials, then you can become licensed in any state that you want. So you don't have to just stay in Kansas. That's why they're called national board exams, because it makes you eligible to work nationally.
Cool. So they can go, like I said, anywhere in the U.S. and go to work with an RT, with their RT license.
Yes.
Wow. So what about some of the courses? Let's talk about some of the courses that the students are going to take, and the hands-on elements. I know you two ladies especially were pretty busy over this pandemic year, correct?
Yes.
Yeah. So you guys helped out at Southwest Medical Center and things like that. Can you tell me a little bit about that? Because I saw those articles and I was like, wow, man, they're on it. So.
Of course, Janae and I decided to join Southwest Medical Center and help them because we are registered respiratory therapists, and we decided that was the right thing to do, was to help them when they needed us the most. And so that's what we did. We juggled trying to, teach students and prepare them to become a respiratory therapist, and at the same time we were, helping Southwest Medical Center as well, assisting them with the COVID units. So extremely busy, I would say we were for a while.
Yeah, it looked like it. So, so while you're there, those kind of things are what students will be doing when they come into the program, correct?
Yes.
Yeah. So can you guys just kind of describe some of the classes and the hands-on elements that go into the respiratory therapy program?
Yeah. So we have a kind of a variety of different classes that we actually offer within the program. So we start off with we have traditional face-to-face classes. We actually have hybrid classes as well, and we also have clinicals. And those are the major components. And then what we also offer is distance learning or remote learning to students that live in the Garden City, Dodge City area. And they can actually attend classes on those campuses, and then they Zoom in and can, from a distance, learn the material from the classroom within SCCC. So those are kind of the components. And then we also have lab as well, and lab is a component to one of the traditional classrooms, and that's where the students get a lot of the hands-on experience before even transitioning onto the clinical sites. And if you wanted to add more to that, Janae teaches more of the lab classes, and she's the one that prepares them too for the hands-on.
Like she said, it really just starts out, it starts out very basic. So we're just showing you how to assess a patient, how to understand and recognize somebody that's in respiratory distress. And then we move into learning about the different therapies that we can provide to help those patients that are having trouble breathing, helping get them well if they're sick. And then we move into learning how to even breathe mechanically for a patient with a machine, which is kind of, it progresses over the semesters in those labs.
Yeah, and some of the specific courses within the program that are very specific are more or less the mechanical ventilation portion of some of those classes, and that's where you really learn in depth, how to assist and mechanically ventilate for a patient that can't breathe on their own, essentially. So we do the breathing for them. And also we do a lot of, or we have a class too that's a neonatal and pediatric course that's specifically for children and little, premature babies that also as well need our assistance as respiratory therapists.
Yeah, and Janae, actually, we talked about it a couple of days ago. We had a group of students going through, and somebody was talking about neonatal care or baby care, infant care, as far as respiratory therapy was concerned. And we're like, man, it was hard for me to wrap my head around it. It's hard enough working on an adult, but man, working on a baby, that seems like real tough.
It is always, I think everybody's a little
Yes.
bit intimidated by it, even once you get out into the field, because most of our training is teaching you how to care for an adult, but then babies can be just a whole different entity by yourself. Somebody did ask a good question on one of your tours the other day. They asked if they had to have additional like schooling or training to work with babies, and you don't. Now, I will say if you decide to work specifically in just a unit that has babies or kids, they're going to give you another 6 to 8 weeks of specific training on all the different therapies and the different protocols that they want you to use based on what their hospital and providers want. So you will get additional training, but you don't have to go to any more school to do that.
So it's kind of like the respiratory therapy program will teach you how to do all of it. But if you want to specialize, and that's going to be just kind of where you land after post-graduation, right?
Yes.
Correct. Yeah, we train students to treat a premature infant up until, an elderly patient as well.
Yeah, and I'd imagine procedures are completely different for both of them. So
Yes, very much so.
yeah. So do you guys want to talk about the Allied Health facilities, some of the cool facilities, labs, and that kind of thing that you have over there? Because I mean, the new Colvin Family Center for Allied Health.
You got it.
There
Yeah.
we go. All right.
It is a mouthful.
Brand new building, and we've only been in there about a year and a half or so.
Yeah.
We were
So-
just talking about that. It's been a year and a half.
Yeah. So, and you guys want to tell me about the simulation labs over there, because those are cool. I love the simulation labs.
I can talk about that because we actually just started getting to use them. We had plans to use them last year, and then we all had to go remote by the time we wanted to put it into our curriculum for our third semester students. Because basically what they're doing is taking everything they've learned in class, everything they've learned in labs, everything they've learned in clinicals, and they're applying it to a patient scenario. And at this point, they have to diagnose, they have to treat the patient, and then, of course, we come together and we talk about what could have happened differently, or, just different scenarios of how we could have done it better, kind of thing. But so the simulation lab is a really cool way to bring everything together that they've learned while they're in the program.
Yeah, it really is. And just a question, kind of, I mean, it's on topic, but, it's not really relevant. You guys ever walking around through there and one of those dummies just freaks you out and there's like nobody there? That ever happen to you?
I think the one that you are using this semester, I'd say he's kind of, if it's dark and, nobody's in there and you hear something, I would definitely be a little.
It is funny because sometimes somebody will leave it on, and so then he will
Yes.
blink and breathe, so then that is a little
Oh,
creepy.
my
That's what I was referring to.
But it
yeah.
was great the other day. Like I said, this is my first year, or I guess semester, getting to actually use the simulators, and I realized that they could talk. So one of my students went to do a puncture on a patient, and when they went to poke, I got to say, "Ouch, that hurts!" and they about jumped out of their skin. It was so funny.
Oh my
So they can
gosh.
actually say some things too. It was pretty funny.
Yeah, I just know, like, personally, I'm over there just gonna walking around, or if you guys aren't there and I'm doing a tour over there, and you see those dummies sitting in there, the simulation patients, and you're like, oh my gosh, is somebody in there? Yeah, that's kind of freaky. Right. We'd kind of talked just a little bit about this, about the degrees and certifications, and the time frame. What kind of time frame are we looking at here for start to finish?
We've discussed that back and forth. So it really is, you're only in the program for a year and a half, but we call it 2 years because we do require you to have some of those prerequisite courses done before you start the program. There's 3 that you can take while you're in the program, and that is general psychology, Comp 2 or public speaking, and either chemistry or micro. But the other 4 we do expect you to have done before you start the program. Number 1, there's just not enough time in our curriculum for you to complete those, and those courses that we've chosen for you to have done prior to coming into the program, they're going to help set you up for the rigor of what our classes are going to be like once you get into the program. Plus, it's information and knowledge you need prior to coming to us. So, for example, anatomy and physiology. It's very important for you to have an overview of the whole body and how it works, but also then we'll take it a step further, and Arlette teaches a specific respiratory physiology class that kind of goes specifically in on respiratory anatomy and how it works. So, but we like you to have that foundation first.
So that kind of makes sense, actually, now that you mention that. So the first semester, a student comes in, brand new student, they'll do their prerequisites.
Yes.
And then that's kind of why you guys start your program in January.
Yes,
then,
exactly.
Instead.
Yes.
Okay, there we go. That makes a lot of
Perfect.
sense.
Yeah, that's what it is.
Okay, so and here's one of the biggest questions. All right, well, let's talk about after college opportunities or work opportunities, and salaries and how much these guys can make with a respiratory therapy license. So, what are some of the places that they can go to work after they graduate?
We were talking about some of these, just reminding each other, but we had talked about you can do home health, so you actually go into patients' homes and then you help them get the equipment they need. You help give them education, you check up on them. There's also post-hospital care education and follow-up. We know specifically like Wichita does that, and it's saved their hospital like millions of dollars. The reasoning is that if a patient comes back in with the same diagnosis within 30 days, then the hospital is liable for the cost of that stay for that patient. Ooh. So basically they're saying you sent somebody home that wasn't well enough to go home yet, and now they're back, and that's the hospital's fault. Well, a lot of times those patients for us are going to be respiratory patients, specifically like our COPD patients or our smoking patients, our older smoking patients that may not always follow the smoking cessation rules, right? They go home, they smoke, same thing happens, they come back. But just following up with those patients and making sure that they're following their regimen as far as medications, that they're going to their cardiopulmonary rehab, they're going to their doctor's appointments, they're going to get their their pre-testing done that they're supposed to have done. Those people will follow up, and some of those can be respiratory therapists, and that's how it really saves the hospital a lot of money, is those patients aren't coming back in over and over again because they're actually following what they're supposed to be doing at home. Other ones that we talked about were a long-term acute care hospital, which is basically somebody that was on a mechanical ventilator and wasn't able to get off. So they're not able to go home, but they need somewhere to stay long-term, and so they go into these facilities. Respiratory therapists work with them every day, trying to get them off of that ventilator, build up their stamina, build up their respiratory muscles. So that's another option. And then I think one we learned about just the other day from one of our students.
Yeah.
You can talk about it if you want.
Yeah, she reached out, and she actually started working for one of the schools in Garden City. So we did, I didn't know that I guess respiratory therapists can actually work in schools along with nurses and provide asthma education and treatment and keep kiddos healthy at school.
Wow.
Little kiddos, yeah.
Yeah, that's something you don't really think about.
No, I didn't know about that either, but that's another great avenue for students too to take if they're really willing to want to work with little kids at school and keep them healthy, then that's another option too.
Very, very cool. So yeah, Janae, what you were kind of saying was, that ounce of prevention is worth a pound of cure, right? So, and it saves an awful lot of money in the long run. So I didn't even think about that being an avenue for respiratory therapy either.
Yeah, and of course, hospitals, they're hired there the most. There's hospital settings, and then you have specialty clinics such as like cardiopulmonary clinics or pulmonology clinics that respiratory therapists also work at. As as respiratory therapists, we're great asthma educators at that point, so they get hired in clinics too as well.
Cool. And what about sleep studies for those of us that snore? You guys do that
Yes,
too?
and sleep studies as well. Yes.
The thing with sleep studies too is, and it kind of goes along with the asthma educators. So a respiratory therapist can get, basically they're doing their own training. Like you get a book, you're going to study it, and then it's another credential that you can get so that you could go work in a pulmonary sleep lab, or you could work as an asthma educator in a clinic, or or even go into people's homes and educate on asthma. It's an extra credential, but no more schooling. It's just training that you have to take on yourself, and you start learning about it because it's something you're doing at your work and you enjoy. So then you kind of like make that another avenue for yourself.
Yeah, so it's kind of like what we were talking about earlier with, they'll learn how to do everything through our program and then specialize later on if they like.
Yes, exactly.
Very, very cool. All right, ladies, I think we're getting close to wrapping stuff up here. Is there anything that we needed to cover that we haven't?
I don't really have anything else other than that we just welcome anybody that is interested in respiratory therapy to come see us at the Colvin Family Center for Allied Health. Like we said, somebody there, you can grab them. We'll be able to direct you to us. We could give you our contact information, but I think it's easiest if you just come see us, or you can call the admissions office, you can call the school, and they'll get you directed to the right person.
Absolutely. And I will put the admissions contact information up here toward the end of this video. So if you have any questions or comments, you want to get a hold of Ms. Zachary or Ms. Austin and find out more about the respiratory therapy program, you can call that number or shoot us an email here in a moment. Ladies, I want to thank you very much for coming in. Like I said, Allied Health, everybody's always got questions, and love having you in the studio this morning.
Thank you so
Thank
much for
you.
having us.
All right. Thank you so much, and we'll see you next time.
Bye.
See ya.